from 6 News Studios with live, local breaking news where you live and your hour-by-hour forecast. This is 6 News, live at midday.
Good day. Arthritis can be very painful and frustrating for people who suffer from it. Up next, we're going to talk with an orthopedic surgeon about treatment and some options for you or a loved one that you might want to consider.
But first, as we go to the break, let's take...
As America's baby boomers move into middle age, arthritis will become an even bigger chunk of healthcare costs than it already is. Right now, nearly 50 million Americans suffer with arthritis, compared to 37 million about a dozen years ago. So what are the breakthroughs and what can we do to limit the pain? Dr. Ajoy Jana is an orthopedic surgeon today. He's joining us from Physicians Clinic. We want to thank him for coming in once again.
Thanks so much for having me, Jim.
All right, let's start with the types of arthritis, because my wife has rheumatoid, and I know a lot of people suffer with that out there, but that's not the most common, is it?
That's right. Rheumatoid arthritis goes under the broad heading of inflammatory arthritis, but most people that have arthritis, it's the osteoarthritis, also known as wear and tear or degenerative arthritis. It tends to come on as you get older. It's probably 85 to 90% of all arthritis is osteoarthritis.
Difference in treatment between the two?
Yeah, rheumatoid arthritis usually is taken care of by specialists. There's some exciting new medicines in the last 5 or 10 years for rheumatoid arthritis. A lot of intravenous medicines that are called disease-modifying drugs, and they've really been a breakthrough for that type of arthritis. For osteoarthritis, the basic treatments haven't changed a lot. At the end stage, when patients have completely worn out the cartilage, for a knee for example, a knee replacement can be done. To try to avoid that, the basics are basically exercise, weight loss, anti-inflammatory medicines, and a couple different kinds of injections, cortisone.
Do patients, and I didn't mean to interrupt you, do patients find themselves between a rock and a hard place? I mean, you have somebody who might be overweight and you're asking them to lose some weight and exercise with a bum wheel already. So do they kind of complain about that as being, well, that's my only option, I'm in trouble here?
Sure, yeah. To lose weight, you usually have to combine, a healthier diet with exercise, and it makes it very hard when you have an arthritic knee. So our advice is to do whatever activity you can do that's low impact and is comfortable, and that may be swimming, cycling, it may be just simply walking, and walking is a very good exercise.
We were talking off camera, you say hip replacement, knee replacement, about 50-50 for you in your clinic. Do they last equal time when you put in a new hip? Is it permanent? Do you get the same result with a new knee?
Oh, that's a great question. Most orthopedic surgeons would say hip replacements last longer than knee replacements, so we are a little more reluctant, or we tend to wait a little longer to recommend a knee replacement for somebody. They do look like they'll last 15 to 25 years, but that's a broad range, and for some people it's a lot less than that. It really depends on activity level.
Last time you were here, we talked about a less invasive hip replacement procedure. Is there any kind of breakthrough similarly with a knee replacement?
I would say that there are some doctors doing somewhat less, they would call it less invasive, but probably just smaller incision, but there really isn't any breakthroughs there. There are a few different ways of going into the knee joint, but the vast majority of orthopedic surgeons use a traditional approach for a knee replacement.
All right, Dr. Ajoy Jana is from Methodist Hospital in the Physicians Clinic. If you want to get a hold of him, that's how you do it. We appreciate you coming in. I think a lot of folks out there learned a lot and may have had some insight on a disease, or it's not a disease, an ailment that is in their family, whether it's them or a loved one.
Thanks again for having me.
My pleasure. All right, still to come, another check of Rusty's forecast for the afternoon.